This is like, today is like having backstage passes to your favorite concert. So it's like Elvis, the Beatles, and throw your favorite group in there. So this is what it's going to be like today with these three very prestigious and renowned researchers. So Lou, take it away, get us through the business end of this thing so we can get to the meat of it for sure.
Yes, sir. Okay, excellent. We'll go ahead and call the meeting to order at 1:03. Let's just start quickly by going through roll call. Katie, can I ask you to do it as you do it well, ma'am, for us?
Absolutely. Amy Baker. And if I could remind everyone to unmute themselves rather than raise their hand, it's hard to do roll call and look up. So if you could just unmute yourself and say you're present, that'd be great. Patrice Brown.
Present.
Alex Canepa.
Present.
Kim Etzinga.
Present.
Juan Escareno.
Present.
Deanna Marin. Okay. Dawn Medley.
Present.
Stephanie Muirhead.
Present.
Ken Novus. Ken Novus. Dr. Delisha Pruitt.
Present.
Todd Regis.
Present.
Tammy Rosa.
Present.
Lou Rubel, I know you're here.
Present.
Michelle Schulte.
Present.
Lori Solatoro.
Present.
Wade Sires.
Here.
Pam Yeager.
Present.
Senator Brinks.
Brianna Egan here on behalf of Senator Brinks.
Thank you. Representative Wenzel. Senator Daley. Representative Whitworth. Diane Golzinski. Jamie Summers Mitgo. Okay. Okay, Mr. Chairman, we have 17 present.
This is Deanna Medding. Katie, I don't know if you got my present. I'm sorry.
Oh,
I was
no, that's okay.
disconnected. I think
That's
the
okay.
moment you said my name. So Deanna
Thank you,
Medding,
Deanna.
present. Thank you.
Thank you.
Okay, thanks, Katie. We have a quorum, so we'll go ahead and move forward here. So the minutes for last meeting are the next item up for discussion. Those were posted on the Food Bank Council website. We're very thorough. Would like to pause for a moment to see if there's any discussion about the minutes. If not, if I could have a motion to support in second, and then just for Katie and Dawn's record keeping, if you are willing to support or make a motion or support, if you could just say your name aloud so that way they can keep track of who is responding, that'd be great. Any discussion? If none, can I have a motion to approve the meeting minutes from 9:15?
Hi, Lou. This is Diane Golzinski. I'll move to approve the meeting minutes as presented.
Thanks, Diane.
And this Patrice Brown, I'll second.
Thanks, Patrice. Okay, any other discussion? Hearing none, all in favor of approving the meeting minutes as presented, say aye or raise your hand.
Aye.
Aye. Aye. Aye.
Okay, we'll clear hands. And if anybody's opposed, please say aye or raise your hand. Okay, minutes are approved. Moving forward, approval of the agenda. So folks who have not taken a peek at it yet, it is attached to the meeting notice. And we will be moving forward with approval here. If there's no discussion, we have 3 presenters and then discussion, new business, review of action items, and adjournment. So if I could I have a motion, please, to approve the agenda?
So moved.
Motion made, Todd Regis.
Thanks, Todd. And support?
Support, Stephanie Muirhead.
Thanks, Stephanie. All in favor? Please indicate with aye.
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 And any opposition, please indicate with the same. Okay, so agenda is approved. Dr. Knight, I would like to turn it over to you, sir, for, oh, I'm sorry. Let me confirm that we do not have any public comment today. Katie, can you confirm that that is accurate, ma'am?
That is accurate.
Yay. Okay. So Dr. Knight, over to you, sir. If you could lead us through the meat and potatoes, the Elvis/Beatles concert as you so kicked off, sir.
It's my pleasure. And again, hi, everybody. And I'm really enjoying our Zoom calls with everyone. And thanks for all your emails. And it's just been a great to get to know all of you. I want all of you to get to know our friend, Dr. Craig Gunderson. He is on my upper left corner here. I'm going to just go ahead and name him Elvis here today because this is a real treat for those of us in emergency food. Dr. Gunderson's work really impacts our work. I mean, he helps us understand so much about our work, not only about who's food insecure, but where they're at. And his reach is all across this nation, across the Feeding America network. And Craig is the ACES Distinguished Professor at the University of Illinois. And Dawn said it's Urbana-Champaign. And there's a I don't know the way to say that that's really cool that I think I messed up. But anyway, Craig, thanks so much for taking your time and being here. And tell us a little bit about yourself and then jump right into your presentation, and Stacy will help you with that as well.
Okay, thank you very much, Phil, for that kind introduction. I also want to thank you so much for this invitation. This is fantastic to be able to speak with all of you who are doing such amazing work in this area. So I really, really do appreciate it. So just as you know, I do work on the causes and consequences of food insecurity. And on the evaluation of food assistance programs with an emphasis on SNAP. I work closely with Feeding America, who over several different dimensions. I'm on their technical advisory group, so I do a lot of work with them on that. I also do their annual Map the Meal Gap estimates, which I'm going to be talking a little bit about today. And my colleague Jim Ziliak and I have an annual report we do on senior hunger, and this year for the first time on hunger amongst those in the age group from 50 to 59. So I'm looking forward to beginning my presentation whenever you want. And my understanding is that I'll speak for 20 minutes, and then if there's questions, I can take those. Is that correct?
Yes, absolutely. That works. So here we go.
Okay, sounds good. I will be done in roughly 20 minutes, but I will definitely will not go over. So, well, thank you again. So what I'm going to be talking about today is I was asked to speak about who is food insecure in Michigan. And in taking this I want to talk a little bit about COVID, but I really want to emphasize something, is that all of you have been involved in the anti-hunger space for years. And for the longest time, we've been encouraging people to take seriously this issue. And a lot of people think like, oh, it's an issue because of COVID. As you all know, it was an issue long before COVID, and it's going to be long after COVID is done in 6 months or however much longer COVID lasts. And then I hope people will still pay attention to it. So in my talk today, I'm going to be talking about some issues of COVID, but I'm going to be talking about a lot of other things, especially as they pertain to Michigan. Okay, next slide, please. I think in some cases, I'm sorry, you may have to hit the enter button. Thank you. And you could just do it 2 more times on this page. Perfect, that's good. Okay, now I want to make sure that we are all on the same page with respect to this. And I always put this up, but I think it's especially important now. There's been a lot of other measures of food insecurity that have been floating around, and this always creates problems, especially during this time of COVID. There's been some projections about increases in food insecurity, which just probably are based upon measures that aren't really food insecure measures and other things. So I'm going to set that aside for now, and I'm not going to be talking about those projections, but I do want to talk about when we talk about food insecurity, what we mean with respect to this. And there's 18 questions on something called the Core Food Security Module. It's been on a number of different surveys, whether it be on the Current Population Survey, which is used for the official results, including those that were just released for 2019 a couple of weeks ago, and for various other things, including a survey that's done at University of Michigan called the Panel Study of Income Dynamics. Done a number of different surveys. It's become the standard. When we say this is what food insecurity is, this is what we mean. And this measure has become so well ingrained that it's as useful. In fact, I think in many ways more useful than the poverty measures. These are some of the questions that are used that are on the survey. They vary everything from a sense about worrying, is I worried whether our food would run out before we got money to buy more, all the way up to the most severe, did a child in the household ever not eat for a full day because you couldn't afford enough food? Okay, so that gives you the range of this. And then we say a household is food insecure if they have 3 or more affirmative responses. And this is the measure that I'm going to be using throughout my discussion today. There's other measures we could talk about, but I'm going to be using this as my measure. Okay, next slide, please. Okay, we're here to talk about Michigan. And so this map here is taken from Michigan for the most recent Map the Meal Gap. For those of you who are interested in this, is if you Google Map the Meal Gap, is you'll be able to get county. Oh, sorry, but you want me not to be muted, right? Anyway, is that in terms of this gives you the most recent estimates of food insecurity in Michigan, and what you see there is that a lot of pockets of really high rates of food insecurity. Michigan is, in many ways, Michigan is doing great. In other ways, it's not doing so great. As you can see, Wayne County has higher than average rates of food insecurity, as is large parts of the the northeast of this. The UP isn't doing very well. My hunch is, at least in some of these counties, they may have American Indian reservations on them, which leads to really high rates. What you can see is that in Michigan, it's both an urban problem. Look at Wayne County. I think that's Wayne County. If I'm wrong, then I feel like an idiot. But anyway, and then in the lower right. But also, if you look at a lot of these other, UP is predominantly a rural area, as is a lot of the Northeast. So this gives you a picture of what it looks like right now. I mean, from 2018. Next slide, please. Okay, so one thing I was asked to talk about are COVID-19 projections. And one thing that we've done with Feeding America is, because you can imagine when COVID-19 hit, is food banks wanted some information about what's going to happen into food insecurity in over 2020. The most recent year we have data for is 2018, and only recently 2019. But what we did is we made a lot of projections about what's going to happen to food insecurity in Michigan and across the country. For those of you interested in county-specific estimates, is you can go to the Map the Meal Gap, and they will have those on there. So what do we project for Michigan? Is for the full population in Michigan, is we project a 38.2% increase in food insecurity, and for children is we project a 63.3% increase in food insecurity. Now, there's been some other projections out there which I will call irresponsible, but these projections are based upon the standard measures that we use, based upon the expert consensus about what's going to be happening to unemployment, and then various other factors. Okay, these are the projections that we have. If this holds, if we come back in 2020 when we conduct the survey in December, this is what we're projecting. If this holds, this is an unprecedented increase in food insecurity in Michigan, and for that matter, it's an unprecedented increase in food insecurity in the United States, much higher than it was during the Great Recession. For reasons we can discuss, is we actually think that these might be a little bit too high. We can talk about that more if you wish. Is when every state there's a lot of variation across the state. As we know with respect to COVID, is that it hits the service sector much harder than it does other sectors of the economy. So I'm not that familiar with any of these three counties. Well, Oakland I am somewhat, but as you can see, the lowest projected increases are Washtenaw, Oakland, and Hillsdale. And the highest projected increases are in Chippewa County, Luce County, and the highest is in Mackinac County. Mackinac County, of course, is a heavy tourist area, which I presume has been hit really, really hard with COVID. So therefore, we see this variation across the state. But again, if you're interested in county level specific estimates, you can look at this. Okay, so next slide, please. Now, what I want to come back at the outset, as I said, I want to talk about who is most at risk of food insecurity pre-COVID, post-COVID. When talking about these determinants, is one thing that we also have to recognize is these determinants are especially relevant during COVID. Okay, the first thing I want to talk about is the issue of food insecurity amongst Black persons in segregated areas. So overall, Blacks have higher rates of food insecurity, but it's interesting is it depends upon a lot of the area of the country and various other factors, but whether or not Black persons have higher or lower rates of food insecurity. So next slide, please. I don't mean to pick on Wayne County, but boy, you guys got that's a really segregated county. And what we have here is by zip code in Wayne County, and the dark blue triangles are areas with 50% more, zip codes with 50% or more African Americans, and the red ones are with less than 50% Blacks in those areas. What you can see is this, to me, is the most stark picture, and I don't mean to pick on Wayne County, of the segregation that's existed in Wayne County for historically and unfortunately, presumably today. Look, is the blue line is the average for Wayne County, the red line is 10 percentage points higher. There's not a single majority white zip code with higher than a 30% food insecurity rate, but there's more than about a dozen with higher than this, okay? And there's only one majority Black zip code with a higher than, with a lower than average food insecurity rates. All the other ones are majority white. So if you want to talk about existing segregation and the problems of segregation still facing Wayne County and other places, is point them to this map here. Okay, so this is some work I've been doing with others at Feeding America. This is really stark. Next slide, please. It doesn't have to be this way though. Okay, this is Harris County, which is Houston. Houston is in Harris County, and you can see the level of, there's not a lot of segregation in Harris County. Harris County is a much more integrated area than Wayne County, and consistent with this is you don't see the stark picture that you saw on the previous slide. Again, I don't mean to pick on Wayne County. If I put up a slide for Cook County, it would look very much like Wayne County. The next slide, please. Now I've done this here for Oakland County, which actually seems to be doing pretty well. I know next to nothing about Oakland County, but what you can see is there's two areas that are majority Black that are higher than 10%, higher than 20%, and there's two majority whites areas. And similarly, within that gap between blue and red, is you see that it's more mixed. So in other words, it's not across all of Michigan that we see some of these high rates of segregation leading to really grave disparities in food insecurity, but it definitely is the case, at least in Wayne County. Again, apologies to those in Wayne County. Next slide, please. Just go one more, please. One more, please. Thank you. The next one is disability status. We don't talk nearly enough in the anti-hunger, well, we've talking more about it, is we need to talk a lot more about disability. If you want to know what's going to be food insecure in our country, look to disability status. Whether it's a child that has a disability or a parent who has a disability, those households are in much, much greater danger of food insecurity. In fact, it's far and away the leading predictor of food insecurity in our country today. Next slide, please. So this really shows this, okay? Is what you see in the slide is the food insecurity by income and disability status. So households that are poor, if they have someone with a disability, it's a shocking 45% food insecurity rate. Conversely, if no one is in the household disabled, it's less than 30%. You can even look at this, is look at those below twice the poverty line, is what you see is persons with disabilities, households for someone with a disability has a higher rate of food insecurity than those who are poor for the full thing. This really points out food insecurity in our country is kind of a problem of poverty, but it's more a problem of disability status. Next slide, please. Same here, is even amongst African Americans, and if we break it down into this, is really the story is more about persons with disabilities who are African American or persons who are with disabilities who are Latino. This is the story. We have to be talking more about disability status and doing more on this topic. I can't emphasize this enough. It's something we really need to be talking about, especially in the time of COVID. During the time of COVID, those with disabilities, whether they be mental health disabilities, whether they be physical health disabilities, they're bearing the brunt of this, of COVID in many ways, okay? Whether it be in terms of death rates, whether in terms of losing jobs, whether it be having to care for persons with disabilities without all the regular support thing. We got to be talking more about disability status and food insecurity. Next slide, please. Okay, 1, 2, 3. Okay, now this is another group, is there was this whole thing about college hunger. You know, those people talking about college hunger. The main problem in our country is not about college hunger. It's about those who aren't in college between the ages of 18 and 30. In all this rush to talk about college hunger, we've forgotten that those who aren't in college of the same age group are in much, much graver danger of being food insecure. Next slide, please. And this really points this out, okay? Is that if you look at this, this is from 2014 to 2018. If you look at full-time college students, is their rates, that's in blue, are far below the national average, okay? And part-time students, which are predominantly community college students, is that these are roughly the same as the general population. But look at the red lines up above. We should be talking more and more about those who are not in college in this age group and stop talking so much about college hunger. We need to reach out to make sure that they're doing better. Now, again, this doesn't mean there's no college students who are hungry. I'm not saying that. It's roughly 10%, but it's not nearly as big an issue as in other contexts. So this is really an important point, especially during COVID-19. It's the non-college graduates who are much more likely to lose their jobs. We got to be concerned about this. Next slide, please. Okay, go down 3, 2, 3, 4. Okay, there we go. The final key determinant I want to talk about is, especially since I see that somebody from Meijer is on the line, and I'm sure there's lots of other, there's a lot of other people who are on the line who from other of our great grocery stores across Michigan and across the United States. You guys are doing a great job at keeping food prices low, okay? I always say one of the best things that can happen to a poor neighborhood is if Meijer or Walmart or any of these other big food stores move in those areas, it drives down food prices. In general, Michigan does pretty good in terms of low food prices. But remember, is that the lower we can get the food prices, the more we can get food to people. The main reason for this is that all of us on this phone call, if food prices are high, we can still afford the food. I mean, Illinois pays me generously. I can afford the food if it goes up in price. Those who are poor can't. Okay, so we got to keep prices low. So make sure those regulations stay away from Meijer. Make sure those regulations stay away from all the food stores. Let them come into these areas. Next slide, please. I'm going to skip over this and the next slide. I'm going to go over it really quickly. We are all concerned about food insecurity because it's sad when somebody is going to sleep at night hungry. It's sad when the child doesn't know where his or her next meal is coming from. But there's also these many serious health consequences associated with food insecurity. And go to the next two on here. Now right here. Okay, stop there. Healthcare costs are much higher in the United States because of food insecurity. Food insecurity is the leading public health issue in the United States related to nutrition. No doubt about it. Okay? So we need to be talking a lot more about this, about food insecurity, and over $52 million a year in healthcare costs for adults alone is due to food insecurity. And you know how we can do this? Is we can bring people on to SNAP. Next slide, please. Oh, I'm sorry. If you could go put all the things up there, please. That's good. I'm not going to be any sort of objective person about SNAP. I love SNAP. Okay. Far and away the most successful government program we have. I'm not going to be an apologist for government programs. A lot of government programs don't work so well. But if we ever want to say what works, point to SNAP. And why is this such a great program? We need to talk about SNAP as medicine. And I'm going to, before turning to why it's so great, I want to say this. SNAP sets out to reduce food insecurity. It succeeds beyond belief. Study after study after study has shown that it leads to reductions in food insecurity. Okay, by leading to reductions in food insecurity, it then leads to reductions in healthcare costs. So the next time somebody says, "Oh, we can't raise SNAP benefits," or "We don't want more people on SNAP," or whatever, I'm not sure what the dialogue is like in Michigan. Tell them that. Well, I'm not saying that every dollar spent on SNAP leads to an equivalent reduction in healthcare costs. It does lead to reductions in healthcare costs. We can talk about that more. Why is it so successful? 4 reasons. First is it reaches those in need. It really is a well-directed program. Is the eligibility criteria, make sure that those who are most in need is getting it. I mean, actually, it'd be best if they got rid of that stupid asset test, but I know that you in Michigan had some problems with that. But at any rate, is that, no asset test or nothing, but I do think that the other components of this actually are a useful way to get people a program. The other thing is SNAP, it reaches those in need, and I've argued in 2 papers in particular where I think we need higher SNAP benefits. It's still a generous program. Let's not forget this is a generous program. The maximum benefit for a family of 4 is roughly $8,400 a year. This is a generous program, and it's reaching those most in need. And the way the benefits are constructed is it's inversely related to income, so those who are more in need are getting more. Second, it's got this effective mechanism. Okay, there's 250,000 food stores across the country where people can use their benefits, and we give people a card to go to a food store and use it there. It's remarkably efficient. Okay, we have all this food everywhere. We're giving people a card to have them go purchase it. What could be better? Third reason, it's an entitlement program. We can never lose the entitlement program of SNAP. It's so critical that we keep the entitlement program at the national level. So during COVID, benefits automatically expanded. Fantastic. Okay, but it's also at the individual level. Okay, even though the average length of time on SNAP is a little bit less than a year, there's millions of people who will need SNAP for a longer time period, whether they be persons with disabilities coming back then, persons who just struggle for whatever reasons, persons who are seniors, they're 75 years old, they're probably on this program for a while. It's not like their income's going to change. That individuals can need to be on this program for as long as they need is great. By the way, and don't let anybody tell you that it's because it's an entitlement program that it makes people not want to work. That's not true. We all know the construction benefit levels are inversely related to income, and therefore people will go to work. SNAP doesn't discourage people from working. We could talk about that more. I have 1 more minute, and what I'm going to finish was with the most important part of SNAP. Is SNAP treats recipients with dignity. I get so tired, especially some people in academia who are like this, who love to tell poor people how they should lead their lives. Can't stand it. We should give poor people the same dignity we give to everyone else and let them make their own choices. Let them go to food stores and let them go to the Myers and the Walmarts and all these other places to make purchases that alongside their brothers and sisters, alongside their neighbors. Let's not say you have to go somewhere else. That's what's great about SNAP. The other thing is, what's great about SNAP is it lets people make their own food choices. We're not having some nanny state telling people what they can and can't eat. We're giving people the freedom, the dignity to make their own food choices. Let's keep it that way. Thank you.
Thank you, Doctor. So I'm going to say that we should probably do a quick poll. Has anybody ever had a college professor that enthusiastic? I'm going to go no. So super. Hey, Doc, we have a couple of questions here. So Diana Marin is asking, what percentage of non-college students are working? Any data on that?
So Diana, I don't have that information right on the top, the top of my head. I don't have that information. We know that they're probably working at roughly the same as the rest of the population. So during when we had really low rates of unemployment, we had high workforce participation. But one thing I want to point out is that during COVID, one thing we can't, and I'm not going to get into the whole debate about whether things should have been shut down. I know that's, or to the extent to which things should be shut. I don't want to get into that debate. But I do want to state the following, is those with college degrees, on average, their earnings weren't that much impacted by COVID restrictions. It's mainly those who graduated from high school, who didn't go on to college. It's those who maybe dropped out of college. Those who are in those jobs who are low paid, those were the ones that got hurt most by COVID restrictions. So in other words, let's keep, again, I'm not going to take a position on whether what Michigan or Illinois is doing is right or wrong versus other states, but we have to remember that those who get hurt are not on average college professors or other people like me. It's those who are not without college degrees are getting hurt the most. And so I think we really need to remember that.
Thank you. Very quick question here from Lou. Is the indicator of disability based on the Social Security Administration definition or another definition?
So our definition that we use for this is taken from the current population survey, where there's 5 criteria to see if somebody is or is not self-reports a disability. It's not based upon somebody's labor force participation, and it may or may not be based upon the Social Security definition. So in other words, somebody could be working full-time with a disability or not getting any Social Security. One thing I want to emphasize, that there's 5 different things, and for those who are interested, I can provide some more details about how this is defined. One thing that I think is especially important in this is we know that a lot of people with disabilities are in the labor force. Okay, and sometimes when we talk about disability, it's oftentimes defined as those who are unable to work with a disability. We know a lot of people with disabilities. The second thing I want to emphasize about that is this issue of hidden disabilities. It always bothers me whenever people are critical of, if they're parking in, I don't know, a handicapped spot, like, that person's on handicap, or saying mean things about this person, or maybe somebody is probably the most hidden one is those struggling with mental health issues. It's heartbreaking when people don't have the appropriate amount of sympathy for them. And actually, what we find is that those with mental health challenges have the highest rates of food insecurity out of any disability category.
Well, Doc, thanks so much. Tremendous presentation. I kind of had a flavor of what it was going to be like from our Feeding America times. So just thanks so much for your time today, your presentation. And if you don't mind, we probably like to reserve the right to follow up with you, because we have a paper due to the governor the 1st of November, but then we have 15 more months to continue this work.
Okay, great. Do let me know whenever I can be of help. I would love to help out. So thank you again, Phil. And also, I wanted to thank everybody in attendance for this. The work you're doing is incredibly important, and it fills me with a great deal of joy to see that my work may be of some use to somebody. So I'm really happy about that. Will there be questions later? Did you want me to stay on, or I don't know how this works in terms of these meetings?
We're going to have a couple of more presentations, and so you feel free to do what you want, but you're absolved at this point.
Okay, great. Okay. Well, thanks so much. Thank everybody. And thanks again. So we'll see you all later. Okay. Bye-bye.
Thanks, Doc.
Bye.
So everybody, thanks for the questions and comments there. Lots of great information. And we'll be sharing more about the MAP to Meal Gap study that we have access to through the Food Bank Council as well. In fact, some of the one-pagers that we've sent to you about your home area is a result of that MAP the Meal Gap study from Dr. Gunderson. Next up for us is Dr. Alyssa Beavers. Alyssa or Elisa? It's an Alabama thing for me.
No, it's okay. It's Alyssa.
Alyssa. So kind of the neat thing for me was I got an email from, and I get a lot of emails, right? And I got this email from this person from Wayne State who said, hey, we've looked at some of the impact of COVID's had on food insecurity. Well, guess what? That email got my attention, And as a result of that, we have Dr. Beavers here with us, who is from Wayne State University by way of Michigan State University. I shared a little bit with you yesterday about some of her work. And so, Dr. Beavers, thank you for being with us. And it's your microphone.
Well, thank you so much for having me. And I was so excited to hear about the Food Security Council starting in Michigan, and I'm very excited for all of your work. Does someone have my presentation, or should I share my screen?
I think Stacy has that, and she'll guide us through it.
Okay, great. So as Phil mentioned, I'm from Wayne State, and I am in the nutrition department, and I'm a registered dietitian. So I will add in some more nutrition specific things to the conversation as well. Next slide, please. So the last presentation was a really great introduction to come before this. But I wanted to talk about the connections between these various things and how the disparities that existed pre-pandemic are affecting what we're seeing today. So as all of you are involved in food security in some aspect, you know that economic conditions such as employment and income are very, very important in determining food insecurity. And from a more nutrition perspective, we know that those who are food insecure tend to not have as nutritious diets due to difficulties in affording healthy foods and focusing more on just getting enough food to feed themselves and their families. We also know that people who are lower income and people who are food insecure have higher rates of chronic diseases that are related to diet. So things like type 2 diabetes and heart disease are higher in food insecure populations. And so now that we've been thrown into the pandemic context, as we know, it's not just a health crisis, but it's also an economic crisis. We've seen a lot of people lose jobs or have reduced hours or income at their jobs. And so we know that that is certainly going to have a massive impact on food insecurity now, and it's going to last for quite some time as people are, tapping into their emergency savings to get by. Once they get back to work, if they get back to work, they're going to have less money to get by going forward. And so all of this has worsened the disparities that we see in racial ethnic groups, as well as in lower income populations in things like food security, nutrition, and chronic diseases. And this is especially important right now during COVID because chronic diseases that are related to healthy diet, so things like type 2 diabetes and heart disease, have a massive impact on what happens to someone when they have COVID-19. People who have type 2 diabetes or have heart disease are much more at risk of severe COVID-19 infection, hospitalization, and death. And we see this really brought out in the racial disparities in COVID-19 outcomes, where we have people of color who are at much higher risk of severe COVID-19 infection and death. Next slide, please. So with that background information, I'll talk a little bit about the survey that we did this summer, focusing on basically anything related to food during COVID-19. So we asked about people's food worries, their purchasing behaviors and challenges purchasing food, food security, and some nutrition related questions. This survey has actually been being used in several different states across the country, as well as a nationwide survey. And we, for our particular survey in Michigan, we advertised on Facebook to recruit people to take the survey, and we are looking specifically at Michigan adults. And the survey was fielded in the second half of June, and we had 484 complete survey responses that included the food security status questions. Next slide, please. So I do want to take a minute just to point out that our respondents were not fully representative of the state of Michigan as a whole. So I don't want to try to say that all of this data is going to be fully accurate of if we had gotten a representative statewide response. So do bear that in mind. We had an almost entirely female survey respondents. we had a less racially and ethnically diverse group of respondents than the state of Michigan as a whole. We had about 87% non-Hispanic white compared to 75% for Michigan. The average age was 46, and about half of respondents were between age 37 to 53. We had a substantially higher educated group of respondents than Michigan as a whole, and that may be because we tended a little bit younger. We had fewer older participants where, people who were older, it wasn't as big of a thing to go to college or get graduate school when they were in the age of people typically going to school. We also had a slightly lower income group of respondents in the state of Michigan as well. And so if we look at overall food insecurity rates, I think it would be a little bit of an overestimate. And so I am going to compare you to some data that was collected from a representative sample to give more of an overall picture of the food insecurity rate in Michigan during COVID-19. Next slide, please. So in our group of respondents, we saw some really stark groups that were at much higher risk of food insecurity. And so first we'll look at employment disruption. And so we are defining this as anyone who had some sort of job change after the COVID-19 pandemic. So that included people who were laid off, furloughed, or had their hours reduced at work and therefore a reduced income. So not surprisingly, they had a nearly double rate of food insecurity compared to people who didn't have any change in their employment status. We also saw that households with children had a much higher rate of food insecurity than households without children. And I do want to point out that we didn't ask about food insecurity status of the child, it was just of the adult. So I don't want you to think that nearly half of Michigan children are food insecure, but households that have children within them tended to have a much higher rate of food insecurity. Next, we'll look at income, education, and age from our survey. And then because we didn't have a lot of respondents of racial ethnic minority groups, I'll pull in some other data for that. Next slide, please. So not surprisingly, since we know that income is such a big factor with predicting food insecurity, we see that there's a very clear trend of food insecurity by income. But I do want to point out that even households that are at an average or even above average level of household income in the 50 to almost 100,000 range, of our respondents, we had a very high rate of food insecurity. So this is suggesting that even people who are at more of a middle income are still experiencing quite a bit of food insecurity. When we go over and look at education, so as he said in the last presentation, people with a bachelor's degree or higher had a much lower rate of food insecurity. And so that is very likely reflective of the fact that people with a bachelor's degree or higher may have the types of jobs where they can work at home and so weren't as impacted by employment or income loss from the shutdowns. Next slide, please. And so when we looked at age, we actually didn't see a huge level of food insecurity in the 18 to 30 range. And so it was fairly steady from 18 to about 60, ranging from about 34% to about 41% in these various categories. But what we did see is that people over age 60 had a lower rate of food insecurity. And this does actually track pretty well with the national level data right now, looking at food insecurity by age. People who are older have longer to have amassed income and wealth that can kind of buffer them from job-related issues, and they are also less likely to have children in their household, so they have fewer people to take care of. Next slide, please. So here's where I wanted to bring in some of the other data that has been collected on food insecurity. So the Census Household Pulse Survey has been conducted since the COVID-19 pandemic to be able to get kind of a rapid view of lots of topics that could have been affected by COVID-19, but specifically here I'm talking about food insecurity. And so this is a representative sample of Michiganders over the summer. And so overall, let's look at the total rate of food insecurity. They estimated that it was about 23%. And this compares to, like, as the last presenter mentioned, the data from 2017 to 2019 just came out. So that data gave us an average of 12% food insecurity in Michigan. So we see that we've nearly doubled since COVID-19 overall. But now when we specifically look at race and ethnicity, we see really, really massive disparities in food insecurity after COVID-19. So people who responded, Black respondents, had over a third were food insecure, followed by Hispanic or Latino, and then white and Asian respondents were lower than the average food insecurity rate. And so clearly, again, huge racial disparities happening. Next slide, please. And so going beyond who is food insecure, I wanted to look at some other factors related to nutrition and food. And so we gave people this list of coping strategies and asked them which ones they've used to afford food since COVID-19. And so, not surprisingly, the food insecure respondents used more coping strategies overall than the food secure respondents. And for each one of these, the percentage of respondents, whether they're food insecure or food secure, a higher percent of food insecure respondents reported using any of these coping strategies. And if you click, I think a box should pop up. Hopefully. There we go. So these are what I would consider the most concerning, and they also happen to be the most commonly used coping strategies among the respondents that were food insecure. And so stretching food by eating less is actually something we don't see until the severe food insecurity. Typically, people will reduce the quality of their food before actually eating less. And so with such a high percent reporting they're actually eating less food, that was very concerning. And then going into kind of the quality of what you're eating, buying foods that don't go bad quickly and buying different, cheaper foods. So that indicates to me that people are eating less nutritious foods, which, as you'll hear me mention multiple times, we are especially concerned with right now, with keeping people healthy, not only to manage their chronic diseases, which they may be not paying as much attention to due to the pandemic, and also just decreasing the risk of severe COVID-19 outcomes. Next slide, please. So we also wanted to see how worried people were about food, as I'm sure many of you were as well. Getting food became very stressful because you're having to go out and potentially expose yourself, and the stores were out of things. So we asked people how worried they were about various things related to food on a scale from 1 of not at all worried to 6 very worried. And so you can see that for all of the questions, the average score of worry was higher for the food insecure participants versus the food secure participants. And if you click maybe 2 times 1, there we go. So I wanted to call out specifically the ones that were related to affording food. And so the food insecure respondents were much more concerned about things like a decrease in income, losing access to programs that help afford food, as well as just the overall cost of food becoming more expensive. So people who are food insecure are definitely having these concerns about providing food for themselves. Next slide, please. And so we also wanted to see if there was a difference in what people were buying. And so on the right-hand side, we have the percent that reported that they bought more of each item. On the left, we have the percent that was buying less of each item. And so we see that for every single item we asked about, there was a higher percentage of food insecure respondents that reported that they purchased less of that item. And so this signals to me that overall, food insecure people were buying less food, probably because they couldn't afford it. And so that really troubles me with people just not being able to get enough food to feed themselves. And if you click once, from a nutritional perspective, the item that I'm most concerned about is that there's such a high percentage of food insecure people who are buying less fresh produce. Because again, we want people to stay healthy. during the COVID-19 pandemic, and seeing that people are buying less fresh produce was especially concerning. Next slide, please. And so I wanted to see if people were maybe substituting canned or frozen fruits and vegetables for fresh, because perhaps they just didn't want to buy something that was just sitting out and people could have been touching and they could get contaminated that way. However, what we saw was that food insecure people were actually buying less of all types of fruits and vegetables. So not only fresh, frozen, and canned. And so the diet quality is probably going down more in food insecure individuals, probably due to cost. You know, if you are on a very limited budget, you're going to focus on getting enough calories to feed yourself. You're going to be less interested in getting foods that are there just because they have, you know, things that keep you healthy. You want to make sure you're full before you're eating healthy foods. And so again, this worries me from a nutrition perspective about people's overall health declining during this time. Next slide, please. And so I just wanted to end with some of the quick overviews and implications. So as we noted here, there are some groups that are especially vulnerable to food insecurity. Click, please. And so, you know, any policies, programs, and charitable food should focus on reaching those who are at the most risk. Click. Yep. And then from a nutritional perspective, I'm particularly concerned about people purchasing less and eating less fruits and vegetables that we're seeing more in food insecure respondents. And so it's important to increase access to fruits and vegetables through policies, programs, and charitable food. And from a nutrition perspective, we generally say, you know, any fruit and vegetable is good, whether it's fresh, frozen, or canned. And so if fresh isn't necessarily feasible in whatever program, giving out other kinds of fruits and vegetables is also good. And then also just from a public health messaging standpoint of letting people know that it's important to continue eating a healthy diet right now to keep them healthy, to increase their immune systems, but also for management of other chronic diseases that they might already have. Next slide, please. Oh, sorry. So we did do a follow-up survey in August that we have just begun starting to look into data, and we also included some questions on perceptions of food assistance. And I am interested in doing a either larger representative survey or a survey focusing on more high-risk populations, such as people who use emergency food or food assistance programs. So if anyone is, if you know of anyone who would be interested in collaborating with that, I am very open to that. Next slide, please. And so I had assistance from one of my graduate students for this, and so I would like to thank Michelle Litton for her help with that. And I can take any questions if anyone has any.
Thank you so much. I love the slides. That's very, very helpful to us, Dr. Beavers. And we had that presentation. We'd like to share that with the members with your permission as well.
Sure, absolutely.
Great, great, super. So I think that we're looking at, have you met, I think you met Dr. Opal on our team. Yeah. So I'm sure you guys are going to be having a conversation here really soon.
Yeah.
Good. Looks like there's a couple of comments and questions. Lou's asking, did the survey identify how long after employment disruption families became food insecure? We
did not ask that. I will say, so the survey was in June, so it would have been, so we asked about employment disruption since March, and then food security status in June. So. Okay. All right. And then Jamie from MDARD is asking, was there a decrease in meat or poultry purchases? There actually was, and it was much larger in the food insecure respondents than the food secure respondents. And, obviously that could be related to supply. As many of you probably noticed, there were times when there was just absolutely no meat. But then again, those tend to be some of the most expensive items at the grocery store. And so it's also possible that it was an income related issue too.
Sure. And then Michelle is leaving you a note in the chat, I think, if you,
Okay.
So if you can take advantage of that opportunity and communication, do you see it?
I do not. I don't know if I just can't find it.
If not, we'll get it to you.
Okay. Thank you.
All right, Dr. Beavers, thank you so much
Thank you. I
for
really appreciate it.
great work, and thanks for reaching out initially to me months ago. You make me seem like I'm a lot smarter than I really am, so I appreciate it. Thanks very much. And you're welcome to stay, or you're welcome to be absolved as Dr. Gunderson was as well. So thank
Dr.
you.
Beavers, sorry, Phil. Deanna had asked if Dr. Beavers would mind sharing her email by chance.
Yes, I would certainly, if I can figure out the chat function, I'll check in a minute. I'll see if I can share that.
Okay, thank you so much.
If not, we have it, and we'll make sure everybody gets it.
Looks like Dawn shared it, so we're all set,
Oh,
Dr.
great.
Beavers.
Thank you. Great.
Thanks. Okay, thanks everybody. And now with us is Dr. Luke Schaefer from the University of Michigan. Dr. Schaefer, welcome. And you are the director at Poverty Solutions. And I see you're also professor in the School of Policy as well as social work. Are they paying you triple time down there? Because you got to be pretty busy, man. So welcome. Thanks for taking time with us today. This is that we said before you got on that this was like backstage passes to your favorite concert, like Elvis and the Beatles, and I'm going to go Aerosmith there. But
nice.
So it's great to have you and have this kind of access to you. And on behalf of the Governor's Food Security Council, we welcome you. And so please, it's your microphone and your screen.
Great. Thank you. I really appreciated the opportunity to join you and really respect what you all are doing here. And I think it's just tremendously important work. I am a faculty member at the School of Public Policy, the Ford School, and the School of Social Work. And then I run this university-wide initiative called Poverty Solutions. And we get our charge from President Schlissel at U of M to partner with communities and policymakers to find new ways to prevent and alleviate poverty. So we're really trying to get out of the ivory tower and work in partnership and understand that we have tools to bring as researchers and scholars, and we have access to data, we have access to research and analysis skills, but that often we don't have, this is a shocker, but we don't have all the right answers. In fact, we miss huge pieces, and so really think that the only way to do this work well is to be in partnership. And I think this council is a great example of that, where you have representatives from a lot of different spaces that can work together to see the whole picture. I also serve as a special counselor to the Department of Health and Human Services. So one of my favorite things every week is I get to work a lot with Lou and his team at MDHHS, and was really proud to be a very tiny part of the food assistance response of the state to COVID, which was, I think, faster and stronger than any other state in the nation. So I put together just a few slides. I'm a little bit worried that there may be some redundancy with the last presentation that looked terrific, by the way. But I'm just going to go ahead and walk through, and feel free. I have my chat up, so feel free to throw some questions in there as I'm going along. I'm going to just try to talk for about 15 minutes and throw some questions in there. Please just tell me to speed up if I'm telling you stuff that you already know. So I thought it was just useful to say, like, what is food security and where does it come from? And this is sort of one of those measurement questions that we've had of trying to understand what is like an amorphous topic in a very concrete way. And so over the years, the USDA, Economic Research Service, has really honed in on a set of questions that tell us if people have enough food to live a healthy and productive life, a healthy and active life. And so when you see food security rates of the fraction who are food insecure, very, very food insecure, that comes from surveys, much like you were just hearing about, from people reporting on their experiences. And they ask a whole set of questions. I just wanted you to walk through a couple of those questions, and we might imagine some of the experiences that people have. So Stacy will kick it on to the next slide for me. The food that we bought just didn't last, and we didn't have enough money to get more. And food security items, the standard one asks, did this happen to you in the last 12 months? Did you have a time when you had bought food and it didn't last and you didn't have enough money to get more? So what could this look like if we can imagine sort of what the experience that people have? It could be somebody who is, nearing the end of the month, right? Or the end of the pay period, and stuff just really hasn't stretched quite all the way, and they don't quite have enough to make it, right? Or maybe there's a whole week like that where, wow, my food ran out and everything that I have to allocate it, whether it's from my earnings or maybe even help from family and friends or from my SNAP dollars, it's all run out. And in fact, we have a lot of research that shows sort of that end of the month period or the end of a cycle period, right? So the last week of SNAP allotments are periods where kids get into more trouble at school. They have more trouble concentrating on work. We actually know standardized test scores go down if they're taken sort of at the end of that cycle. So you start to see that, like, some people, a lot of food insecurity is in sort of a boom and a bust cycle, in a sense, right? Where this isn't an experience that somebody's having, at least with this question, right, every single week, but making sort of those resources stretch across that month. And there are two ways where that might be a challenge, right? So it might be a challenge in that it's difficult to sort of manage money, right? So maybe a response to sort of this, not having enough to not having, and food doesn't last and I don't have enough to buy more, is to help people sort of manage their money over the month period. Or maybe even more likely, it could be a result of just not having enough money to manage throughout the entire month, right? So maybe it's not a money management issue, but just like a scarcity issue. And I think when we think about this sort of like cycle of people, right, sort of some resources come in, I'm sort of going through the month, and then at some point the food doesn't last and I didn't have enough money to get more. I want us to think about sort of the dynamic experiences of people, right? What we know from a lot of the research these days is that a lot of this is about instability in people's lives, right? You have a lot of people who work, but their hours fluctuate. They go up and down. They go, and in fact, some recent research by some colleagues of mine suggests that that's often sort of the more common experience. It's less common to just have a stable paycheck that's coming in over the course of an entire year. And then you sort of dump on top of that instability in family life, right? Where we know people are sort of more likely to double up than they once were. And if they're doubling up, that means maybe they're sharing some resources, right? Maybe an uncle's come in and he's sort of renting a room, or he's picking up a bill for his rent, or maybe mom and kiddo are living with grandma and grandpa. But there's a lot of instability in that too, where maybe there's a falling out and somebody moves out. Maybe they have some instability and it ripples through a system to, say, a mom and her kid. Stacy, will you go on to the next one? So the first question was really about, did you not have enough and did you run out? And then the second question is sort of what happens then, right? So to be marked as food insecurity, you have to have sort of multiple ones of these questions be marked as a yes. In this case, it's did you cut the size of your meals or did you skip meals because there wasn't enough money for food, right? So this is like, imagine that same single mom and her kiddo, right? Maybe her hours get cut at Walmart. She doesn't have enough to quite make it to the end of the month. Another thing that we've seen sort of instability with benefits, food benefits, is SNAP benefits, right? Maybe she had a recertification and she doesn't get the paperwork, and so she doesn't recertify, and she goes to the grocery store and finds is sort of struck to find that her SNAP balance is 0. Well, this is kind of like, what's the level? What did she do in response to that? In this case, we're asking, did you ever, sort of have your portion, right? And one thing we know is that like moms and dads, they tend to try to buffer their kids as much as possible. So if you want to talk about sort of the highest rate of food insecurity, you can see it. You see kids get buffered before everyone else, to a greater extent than everyone else. And this is sort of one of those coping strategies, right? Where mom or dad are saying, I'm going to take less, or I'm just going to skip. Don't worry about me. I'm not going to eat this afternoon. And then, Stacey, if you go to the next slide, you see in the last 12 months, were you ever hungry and you didn't eat because there wasn't enough money for food? So hungry, right? So I didn't just skip my meal and like, I didn't like it. And maybe that sort of had the impact on my concentration. But here is sort of that experience of hunger and knowing, were you, did you feel it? Was it sort of going with you? The goal with food insecurity is to really understand all of these things in the context of economic need, right? So this is not because I'm going hungry because I'm dieting or because something else is going in my life, but because really I don't have the financial resources to deal with that. And in that way, food insecurity is really interlinked with all of these other factors, right? So you can tell when the number of jobs go down, you can expect food insecurity to go up. When jobs become less stable, right, where you see people engaging in more sort of this instability in scheduling practices, you're going to expect food insecurity to go up. What about housing, right? As the cost of housing goes up, or as housing becomes more scarce, you can expect food insecurity to go up. And even something like auto insurance, right? So just imagine in the state of Michigan, as the cost of auto insurance went up over time, that actually has an impact, probably has an impact of increasing food insecurity, because people are constantly making these trade-offs, right? They're constantly deciding to go, is it better to go hungry and pay my rent? Or should I make sure I can eat and not pay my rent, right? And they're trying to face these decisions about what happens to me if I don't pay my rent versus what happens to me when I go hungry. And it means that sort of food insecurity becomes one of our leading indicators of economic crisis. So we've talked about how instability, right, in the labor market, instability in family life, instability in public benefits, these can all be drivers of food insecurity. And how food insecurity is really sort of interlinked with all of these other factors, a lot of factors we might never think about. If Stacey takes us to the next slide, after we've done all this measurement, right, and those are just 3 of the primary questions, the actual scale, there's a 6-item scale, there's an 18-item scale. These get coded up and they've been shown to be associated with tons of other health outcomes. When we put all those together, we can look at a food insecurity rate nationally. And if you look at that purple line, that's the United States food insecurity rate nationally. Again, this is before COVID. And in blue, of course, go blue, is Michigan. And here's an interesting thing, right? So we've made progress since 2013, 2015. We were in a period of very high poverty up through 2015, and things have gotten better since then. But interestingly, in the years preceding that, the US food insecurity rate is going down, and Michigan has seen an increase over that period of time. That may be related to sort of sets of policies that made food assistance more difficult to access. It may be related to trends in in the economy, right? Maybe related to how fast jobs picked up. But I always find it's really useful to compare where Michigan is to our Midwestern peers. So if you can sort of see they're shaded out, right? We see Ohio and Indiana have similar rates of food insecurity to Michigan, a little bit higher, right? So we're just a little bit higher than Indiana and a bit higher than, a bit lower than Ohio. I always like to see that. Interestingly, look at those other Midwestern peers. So Illinois' food insecurity rate is a good 2 percentage points lower than Michigan. That's pretty sizable. And then I don't know what's going on in Wisconsin and Minnesota. Maybe we wouldn't hold ourselves to a Minnesota standard, but Wisconsin seems like a pretty significant peer state with a food insecurity rate of 9%. So this suggests there's some room to grow in Michigan. And we have not had sort of the trajectory over, we've had a good trajectory, right? The trajectory we want in the last few years, but before that, not as much. Go ahead, Stacy. We talked about that instability, right? Really driving a lot of food insecurity. And this is really a slide that sort of strikes me. This is national data. I don't have this for Michigan, but you can see this pie chart is just folks who are food insecure, right? This is the labor market participation of folks who are food insecure. You can see 51% of people who are in food insecure households are in households where somebody works full time. So this isn't a matter of people simply not working, right? I think we see sort of food insecurity, maybe people who don't have a job, people who are unemployed, people with major barriers to work. But 1 in 2 people who are in food insecure households are in a household where somebody works full time. Another 10% are working part time, right? So that's 61%. We're getting up to, you know, closing in on 2/3 of the food insecure population that is working full or part time. Only 4% are unemployed. We see a very high rate of food insecurity among those who are disabled. So that's making up 16% of the food insecure population. And then, of course, a chunk who are retired and not in the labor force. But the key is that this is inextricably linked to our labor market, whether because wages are too low to allow people to access or employment is too unstable. Go ahead, Stacy. This chart, I'm going to leave it with you. This just sort of looks at some of the characteristics of households, right? What are the rates? So you just see these are the bars are the food insecurity rates among folks who are in these categories. So you can see food insecurity is much higher among households with children compared to those without. That's especially true with folks who are have young children. That makes sense, right? These are households that have more mouths to feed. They also tend to be earlier in their professional trajectory, right? If you have kids, so your earnings might be lower. But it does mean that we do sort of the worst job at protecting households with children against food insecurity. We actually do the best job of protecting the elderly, right? They have the lowest rates of food insecurity of any sort of age group. And that's not to say they don't also experience food insecurity, but they have lower rates. And a lot of people, yeah, great. Diana makes a really great point. No accessible childcare creating unstable employment prospects. That's another sort of one of those examples, right, of this instability that families have to deal with. When you think of the safety net for the elderly, right, there's nearly universal access to Social Security. Some are on SNAP, right? But you build this sort of cash transfer, monthly cash transfer for families and access to medical care. Higher rates among people of color, right? Much higher rates among, especially among Black non-Hispanics compared to Latinos. And higher rates among those in poverty, right? You can see those vastly outstrip every other demographic group. But interestingly, right, it's not just those under the poverty line. You're getting up to 1.85 of the poverty line, right? So nearing double the poverty line, still elevated rates of food insecurity. Stacy, will you take it 2 more slides for me? Perfect. So we've talked about instability, right? We've talked about that families face trade-offs. When we've talked about sort of the strange and unusual sort of factors, I would say like auto insurance, but definitely housing prices, utility prices that we're going to always see is associated with food insecurity. instability in childcare, instability in jobs, instability in family life. I just wanted to talk about COVID for a minute and give you sort of my take on it. We know for sure that there were these very large spikes in food insecurity during March and April, right? As the jobs just shed, right? And the safety net wasn't quite responding yet fully. We see these huge spikes, and I think you could visibly see that in sort of long lines, right? These very long lines in demand for food assistance. And we should have a whole nother talk, right, about food pantries and food programs and how much more they have done for us over, you know, the last decade compared to earlier times, and how much more they're required to do. But interestingly, some of the pre-comparisons for food insecurity, comparing pre-periods to the COVID era, are complicated by methodological problems, right? Where it actually may look like we were undercounting food insecurity like vastly before COVID. And when COVID hit, we started to collect it differently. We started to ask people to fill out surveys themselves rather than have an interviewer. And it may actually be that the rates of food insecurity, like the ones I just showed you, have been way too small, have been way too low for a long time. And so when we've seen some of this research that suggests food insecurity is like 2 to 3 times higher, it actually may just be that we were measuring it worse earlier on, that the problem was a lot worse in 2019, and that we just didn't even know it, right? That there was just a lot more need out there, and that we've uncovered that through COVID. Interestingly, there's this growing and really compelling body of research, including a new Federal Reserve report that finds that the CARES Act provisions really made a difference. And so when we start to get to the July and August, we start to see things really improve for families. The ones that were able to access the provisions that we had, right? Whether it be through SNAP, where Michigan was the very first out of the gate on that, but also unemployment insurance and the EIP. We know people who didn't get those, right? Those expanded more than they've, you know, it's an unprecedented safety net response. And some families are actually better off as a result of it than they were before when they were working, in part because what you got on unemployment insurance sometimes was higher, right? But we also know those who were left out are in an incredibly bad position. So I think we have to see sort of the COVID era as an example, both of the crisis point, right? And think about the long-term consequences of the spikes in food insecurity, but also as a lesson, right? Of the kind of benefits and the kind of ways that we can provide aid on a large scale that really, really help. All right, I've gone over my time. I apologize for that. I'd be happy to take 1 or 2, you know, a couple questions or however long, Phil, you are willing to let me go for.
No, that's great, Dr. Schaefer. Thank you. Thanks very much for your time. I actually have a question and would love to get your take on it because it's a bit of a passion in my mind in regard to this work. And that's about the federal poverty line. We all seem to have a bit of resigned acceptance. I mean, it is 60 years old or so, but my gosh, it just seems that, you know, we keep measuring twice and we still cut wrong because our measuring device isn't correct. And so I'm not quite ready to, I think I've actually figured out that the federal poverty measure is housed across the street from the White House. I'm not quite calling for a march there yet, but it seems to be a root cause. As I say, we measure twice. It doesn't matter how many times we measure, we're still cutting wrong because it just doesn't allow people to have access to benefits that they would if we could update that measure. So I'll stop there and just get your comments, please.
Yeah, right. As Phil points out, that threshold was actually not terribly systematically designed. When it was designed, you know, God bless her, Molly Orshansky, and it was one of those things where Lyndon Johnson declares war on poverty, and suddenly everybody's like, "Oh no, we don't know how to measure poverty." So they took like what they had, and we've had it ever since. So I think it's a really good point, and we have a lot of debates about sort of measurement of what should be included in the numerator and the denominator. But none of that debate really gets into sort of eligibility thresholds. And you're absolutely right, where with SNAP, for example, we're at about 35% of the poverty line is that threshold. Some of the ways we try to deal with that, and something Michigan's been doing a lot of lately, is trying to look for deductions or ways to sort of deal with some of the costs, right? So trying to more fully account for in that income costs for housing, costs for shelter, and to sort of get at some of those families, right, who might have incomes above but have big rent payments. And that's one of the things that's really changed, right? Sort of housing as a fraction of the family budget has just exploded since Molly Orzechowski was doing work. And actually food is less expensive, right? So I do think that there's a lot of cause to look above that line, and some of the data is that I think helps promote that is the ones I showed, right? Where you see a lot of food insecurity among those households that are approaching 200% of the poverty line. So maybe it is time to think about expanding the program to reach there. And in my mind, I always like to look at a lot of different kinds of data. Right. And one of the pieces of data is, right now, not 2019, but let's take the year before. You have about 40 million people who are officially under the poverty line. A roughly comparable amount of people who show up as food insecure in the sort of independent other measure. At last count, Feeding America was finding, I think, more than 60 million are showing up at food pantries, right, and emergency food programs. And so that suggests, that's sort of one of that indicators that suggests there's a lot more people that at some point are sort of struggling to find food. And when you start to stack those up together, you see sort of the problems are, they go well up the economic ladder, to be sure.
Yeah, I think you said it, that dynamic experience, depending on the time of the month, people are in and then they're out and then they're back in. And,
yeah.
And to Diana's point, I mean, we're not the most expensive state for childcare, but we're one of the most expensive states for childcare.
Well, we used to be, actually, but in terms of, if you're thinking of our childcare subsidies, that's another place where we have reduced our commitment over the last 8 years or so. And so we used to be the 11th, invest in it like the 11th most of any state, and now we're the 11th least. And there's a similar dynamic with cash assistance, right? Where not because of the current administration, but previous eras, we have really made that much harder to get. And you can actually see a very clear association between declines in cash assistance and increases in food insecurity among families with kids.
Patrice has a question, I think. Let's see. And I think you have access to the chat there. How can we get a better understanding of determinants that affect income?
Okay. How, I'm not seeing that. Do we get?
He says, really good presentation. Thank you. So that's a good way to start.
I got you. Is that the one? I see determinants that affect income. Great. Yeah, I think, I think of it as you have, just imagine this sort of instability in work connected with instability in family life, right? So maybe somebody can balance out one or the other. But, and then, instability in public benefits, right, is another one, right, where you're trying to manage all three of these. And we know people increasingly have unstable family lives, and that's a source of income, right? So if you're doing a lot of like sharing expenses, but maybe, mom and dad are living with a kiddo and they have a falling out and dad leaves the household, right? That's not just an emotional issue, but a very financial issue. And then the jobs, right, where you have both people's ability to get there, right? Car breaks down. I think we all know that story. can't get to the job and lose the job, but also employers say, nope, I don't have, any hours for you this week. And some employers have been getting better on that. So from a policy perspective and philanthropically, I encourage people to think about policies that help people in a moment of crisis, right? Are there ways that like people can quickly get the aid they need to keep them? How do we keep that person in that moment of crisis in that job, right? Rather than them flaming out, because then that can cause sort of longer and deeper problems. And then also just policies and programs that help stabilize families. Like what are things that we can do to make sure that people have things they can count on? Some of those things might be a child allowance. That's something I've worked on. There's a bill called the American Family Act that says families, low and middle income families should get a certain amount of money every single month, and it should be stable. They can count on that. 2, things that allow families to maybe bank part of their tax refund, right? That's a time when people's incomes tend to go up. And maybe we can match it if people put that in a rainy day fund to access at another point in time.
Excellent. One last question from Lou. Any observation regarding the differences between Minnesota and Wisconsin that accounts for difference in food security rates as compared to Michigan?
Yeah, looking at that slide made me want to dig deeper into that. So I'm going to. I don't know, I want to look at the underlying poverty rate. I think Minnesota is a place that's just more affluent across the board. It has pockets of poverty, obviously, but I'm guessing it doesn't have rates. But Illinois and Wisconsin, those are places that I think, Illinois especially is probably a place that has a lot of comparables to Michigan. So I think that's worth having a close look at and figure out what's going on. So some of it may be policy driven, right? So one thing we know is, able-bodied dependents without children. That's a program that, the time limits on that with SNAP is something that over that period of time I just showed you, Michigan was re-implementing those time limits across the state. And we know that causes people to really shed off of the food assistance rolls, right? In huge numbers, they just fall off. And it has nothing to do with them sort of working or not. It's a lot of confusion, right? It's a lot of sort of maybe technology problems. It's just a lot of things, related to sort of the unstable circumstances that people are in. Unemployment insurance is another one where, Michigan from 2011 on made a lot of decisions to make it much more difficult to get unemployment insurance when you lose a job. So I'll give you just one very quick example there where we implemented a law where if you, in Michigan before COVID and after the emergency is over, this will go back to being the same way in Michigan. If you quit a job to take a better job and then got laid off from that better job, we passed a law that you were ineligible for unemployment insurance because we said, you quit a job, right? You don't want to work, so we're not gonna give you unemployment insurance because you don't deserve it, even though somebody quit the job to take a better job, right? Which would be exactly the type of sort of self-sufficiency we want people to be moving up the chain. And they could have never known they were going to be laid off from that job. So that's something we were able to get rid of during COVID, but it will go back into effect, right? And so there are consequences to policy decisions where that has led us to have the lowest recipiency rate of unemployment insurance, all those little rules in that program. So I can just walk through a number of those. And, I think those are things that, the ABOD work requirements is no longer enforced with the current administration. I think we should see some improvements there. Hopefully some of those changes to UI can be made permanent, and that'll make a difference in people's lives.
Yeah, absolutely. Well, Luke, I hope you'll consent to come back with us. I shared earlier, our first paper is due to the governor on November the 7th, particularly about COVID's impact on food security. But then we've got 15 more months after this to continue this work on a larger, grander scale.
Yep.
So I hope you'll come back and influence us some more.
I'm at your service, Phil. It's a pleasure.
Thank you. Thank you very much.
Thanks for the time.
So I'll say on behalf of the Food Security Council, thank you for being with us. Excellent presentation. We're glad that you're with us.
Thank you. Best wishes with your work.
Thank you. All right. Okay, Mr. Rubel.
Great. Wow. What an information-packed day. And I definitely think if anybody came into this meeting wondering if there was going to be much accomplished, we certainly had a pretty good run here of great stuff. At this point in the agenda, we have a moment here as Food Security Council members just to discuss anything that has arisen so far, if anything kind of strikes us that we want to underscore. I know that Dawn is taking good notes and we'll be quickly starting to compile a report here for our November 7th deadline. Is there any discussion amongst members here of anything they want to lift out of either today's presentations or other items that have come to their attention?
Hi there, this is Dawn Medley, and I just wanted to mention, for whatever reason, I don't have access to chat today. And so I don't know if that's just me or if that's a common problem that others, I know there was a Microsoft glitch earlier.
Oh, okay, good flag. Could everybody maybe just take a quick peek and see if anybody has issues other than Dawn with chat? And if so, you could let us know.
Here, see if you can read this.
So earlier, I didn't have the chat part on mine, and I had to close the Teams meeting and then restart.
I had to do the same.
All right, then I'll just live without chat today, and I'll assume that I get it next time.
Okay,
Right.
Great. Good flag.
Yeah, this is Patrice Brown. I just wanted to make a couple comments, just general about the topics that we discussed today. And I appreciate y'all setting it up to where we can hear these presenters. So thank you guys for your hard work, Phil, and your team. It's pretty amazing what we can learn when we come together. So just a couple things that stood out to me. The segregation numbers from the first presenter were very starking to me from Wayne County. Apparently it was starking to the presenter as well, and he's not very familiar with this area, but it's a significant amount of segregation in the insecurity rates in Wayne County compared to white people versus Black people. And I like to kind of hone in on that as we come to some kind of conclusion about, what's going on in food insecurity or food security in our communities here in the state. And I would love to partner with our northern partners because we see some starking numbers around the northern parts of the state versus Wayne County when it comes to the map that he showed around the food insecurity rates, or I forget the exact map, but it was the one with the green, dark green spots. The first presenter had shown us about what we saw in the northern part of the state versus the southern parts of the state. So I just wanted to point those out and maybe lift those numbers up. The disability rates are very significant. I think we should really consider what's happening in Detroit and Wayne County because we are drivers at the end of the day of some of these numbers. And it's very disturbing for me to see some of this on paper. And it's even more disturbing to see it as I live through the community every day, because I'm one of these community members, and my parents died from comorbid diseases, not from COVID, but from hypertension and diabetes as a result of having those diseases. So I'm very interested in seeing how we can put our work or our minds around what we need to do in specifically the rural areas of our state and specifically Wayne County and the Detroit area around our healthcare crisis that we find ourselves in. I think it's really significant that the last presenter talked about policies and what is embedded in some of these policies. And we have some representatives on the line, so I'm really eager to hear back from our representatives about, you know, these specific policies that keep us in these in our barrier state. Specifically policies around the unemployment. That's ridiculous that if you get a job or you had a job and you quit a job to go to a better job, that you don't qualify for unemployment if your job is affected in the better job that you took. I think those are the kind of intricacies or details that we have to kind of get to so that we can try to give the best recommendations around those things that we see, like really just those pinpoint things embedded into policies that our last presenter talked about. I want to lift those up because that's significant across the board that we'll find that. And I think I'll stop right there because I don't want to take up too much time, but I'll send my concept paper out, Phil.
Okay, great, Patrice. Thank you.
This is Michelle. I just want to echo a lot of what Patrice had said. I mean, the three counties that she was talking about, the northern counties in Michigan, Mackinac, Luce, and Chippewa, as Craig kind of thought was the case, but wasn't 100% sure, those darkest green areas also correlate with the service areas of tribal communities. And Mackinac, Luce, and County, there are 3 federally recognized tribes who have large population sizes in those 3 counties. Those are some of the biggest tribes. Sault Ste. Marie having over 26,000 members. So, you know, overall, when we talk about total population, our Native American numbers don't seem significant, but when you see it on a map and you see those high rates of insecurity and how they correlate exactly with where those reservations are, I think there's something that needs to be said. And I think we really need to lift up the voices of those who are suffering. So, and not just the minorities, but also, as Patrice said, those with disabilities, those on a fixed income. You know, those are the ones that we're trying to lift up. And those a lot of times are the heads of our households who are trying to manage things and have so much on their plate. So again, you know, just like she said, with the policies, there's got to be some kind of way that we could do a scan through these policies. You know, as she said, the unemployment policy, that little quirk in there is something that's silly. I mean, why isn't there some work that we can do to kind of clean up some of those pieces of policy that just don't work for people? Even the limitations on SNAP when we talk about recertifications, especially in our rural communities in the Upper Peninsula, the number one thing we hear from our folks that we're working with is they don't have transportation. So to do a recertification, especially if they don't have online access, which a lot of them don't, they're not going to be able to do that, and they get bumped out of the system and don't have the resources. So I think we need to be lifting up those needs of people who fall below the standards and make sure that their voices are heard in our report here, because they do make a significant portion of our population.
I have a quick question about food insecurity on Indian reservations. It's my understanding that it's up to each individual tribal government whether they participate in FDIPR or SNAP. Is that the case? And if so, do you know if all of the tribes in Michigan participated in FDIPR or SNAP, or is it a mixture?
Not all of the tribes are eligible for that. So there's a couple of issues there. Some of the tribes do participate in SNAP, but it's got limits to it. And then the other side of that is more than 50% of tribal citizens live off of the reservation. And so the limitation for, or the reach for those services doesn't always meet the needs of the population. The other issue there too is, again, just access and certification. Sometimes people aren't aware that that SNAP resource or the GIPR is even available to them, and they're not being referred to those programs, or they fall short for whatever reason.
Thank you.
So Phil, I'm just kind of thinking here of how we're organizing ourselves towards a first deliverable and then a second. And I think that was pretty rich discussion. And I'm just wondering if we want to take any of that into account for perhaps work group activities here for the next couple of weeks.
Nope.
Okay, excellent.
Lots of notes. Policy scans, technology, transportation, rural challenges with transportation versus urban challenges with transportation, all creating access issues. All great topics there. And I think that's the key. It's great to have the data. Man, we need the data. We need it so bad. But now what do we do with it? How do we make life better and come alongside of people along that idea that people are worthy of investing in. So I'm taking notes, Lou, for sure, and I think everybody else was too. Diana, I think your hand was up.
Yes. Just again, this is a great presentation, so helpful. So thank you for everyone who put it together. I again was still floored by the stats on who is food insecure and that over 50% of them are working, and what that means, going back to the policy conversation about why is it that so many working individuals are food insecure. It'd be interesting to see the correlation with non-college workers. And then the other thing is just like going back to opportunities that we have given this pandemic and how the PEBT, the pandemic EBT program that's shifted, the food that was provided in schools into the EBT and basically the SNAP infrastructure, and how amazing that was. I mean, I know just from the farm workers that were calling our hotline to understand whether or not they qualified for this, were there going to be any immigration consequences, and our ability to reassure them, like, this is good, like, take it, you need this right now. Like, it was so helpful to them at that time in need. So to the extent that we can promote policies that also use the current infrastructure that's in place and how to really push out funds for food insecurity in ways that are quick and use what's already in place that has been working in the past.
Yeah, great point. And I think we'll hear a little bit about that in 2 weeks. Diane Gozinski is on the phone. She's on the call here, and I think Diane will be presenting to us about some of those waivers and some of the efforts to make those even more permanent than what they are presently. So that's a nice tee up for you, Diane. So no pressure there.
I appreciate it.
Well, Lou, I'm going to give you plenty of time to close out, but I did want to just share right off the bat here as we get ready to close. Don't want to cut anybody else off. We have a couple more agenda items for Lou to get us through, but I was thinking about this phrase about, if you've ever heard, I think about my grandfather who came in with a big plate of food sometime when the family was gathered and shouted out loud, "Who's hungry?" And it's often a happy question used at parties and family gatherings, special occasions. And you're probably maybe thinking about an occasion like that, and you got a smile in your mind, about who's hungry. And there was a great time, a good memory. But there's a sad side to that question too. And that's what we've tried to answer today about who's hungry. And so who's hungry is at the core of our governor's executive orders. Who's hungry is a question that we must answer to better understand the challenges that those who are food insecure are facing. So who's hungry in Michigan? Well, I think about the children who walk slowly in front of our windows, the seniors who haven't seen them in a week or so, There are moms working 2+ jobs, dads grabbing an extra shift. They're the ones you see at church or in the park. They're the ones dealing with the loss of a job or a loved one, the ones who are anguished by the choice of which bill do I pay? What do I give my kids to eat? They are the ones who had the hopes and the dreams, the desires, who now are famished and robbed of drive and determination because of a lack of food. They're the ones who went to sleep hungry and woke up hungrier, knowing that it only gets worse before it gets better. And those are the ones that this group is standing in the gap for. And I'm proud to serve with you. And I thank all of you for your efforts, your communications, your time, and your expertise. They're the ones. They're our neighbors. It's not them. They are us. Lou?
Thank you, Phil. Well said. If we could take a moment here to discuss new business. And let me just offer that we've had kind of a couple of meeting cycles here where we've had some pretty powerful presentations. We have one more of those scheduled, essentially, coming up next week, where we have folks from our State Emergency Operations Center as well as a local emergency manager coming in. We have our food assistance, our SNAP policy director from DHHS, and our economic stability administrator policy director coming in, as well as Diane. So we have kind of another round of this. I believe that there's probably lots of ideas about after this round is over, kind of what does the future look like for these meetings. We know that we have to hit a first report deadline, but certainly would be welcome, I think, for folks to begin thinking about what does that next 15 months look like. So with that, if we could maybe take a couple, 3 minutes or so and talk kind of along the lines of new business about any thoughts or ideas folks have, just so we can be respectful of kind of all the ideas that are amongst this group for how we might best organize for months. I guess 4 through 18. Or if folks are comfortable with how this is rolling, you know, we can kind of keep using this for now. If nobody has ideas now, maybe we can just kind of resurface this in the future to make sure that, you know, if there is other ways of approaching this task at hand, we consider them.
Yeah, Lou, I would just mention that I think for us to get the most out of our council members and the people that they have in their network is the ability to create work groups. And so I think that we could probably create an interest form of some sort so that everyone could say, here's what I think. I took like notes here for 4 work groups already that we could, you know, certainly implement and as a way to get all of us involved and we can garner everybody's expertise.
Excellent. If anybody has any thoughts on that, either in the chat or orally here, certainly would be welcome to share those.
I like that idea, especially given that, you know, I think as individuals, it's great to put all these minds together, but I like to be able to have time to go back to, you know, my networks and the people that I work with to gather their input too and make sure that we're representing all the bits, because I'm getting older and can't remember everything. So I like that idea of the work groups, and I do like the, you know, meeting on a regular basis. I think once a month would probably be the minimum that I would recommend. I do like the every other week. I think that keeps the conversation going. And, you know, if we have things that we need to go and look for, or people that we need to talk to, I feel a little more accountable to stay up on it.
Great, great. Other thoughts?
This is Tammy. I like the idea of the work groups as well. And I like the idea of, again, as has been mentioned, being able to bring in some of the other individuals in our network and really kind of pull in some extra resources to work together. And monthly is great, but I do like the bi-weekly as well. So I think those are great ideas.
Okay, cool. We're seeing some people shake heads. Okay, wonderful, wonderful. Okay, anything else on this front? And we can certainly revisit this next week as well with some more definition. Okay, the only other item I think that I had flagged here for us to remind folks of is we have the survey, I believe that's out there to try to solicit information and feedback from a wide network. Hey, Dawn, can I put you on the spot from your chair, ma'am? I'm assuming the survey is still open and can be used. Is that an accurate summation?
Absolutely. And you can fill it out by the end of the month. I'll start compiling the report later this week.
Wonderful. Okay, thank you. Excellent. Okay, let me pause for a second for any other new business items that any members want to bring up. Okay, hearing none then, so moving forward for next steps, I know Phil has got some planning underway regarding a work group approach, if you will, and we can kind of flush that out a little bit as well as look at interest forms, et cetera, and can bring that to the council during our next meeting. I didn't have any other specific action items. We have the minutes will be compiled as always and posted to the site. And those have been getting done really quickly, so we appreciate everybody's work that's involved in doing that. Let me pause here for one more second to see if there's any other review of next steps or action items that anybody wants to touch on. If not, we will move to close. So pause here. Okay, hearing none, can I get a motion to adjourn?
This is Michelle Schulte. I make a motion to adjourn this meeting today.
Thanks, Michelle, and support.
A second is Patrice.
Hey, Patrice, thanks for that discussion. Hearing none, all in favor, say aye.
Aye.
Okay.
Thanks, Lou. There's my eye.
Aye.
With that, we are closed at 2:54. Appreciate everybody's time today. Thank you.
Thank you, everyone.